Two passengers traveling from Rwanda triggered a health scare at Hamburg Central Station in Germany, amid fears they could be carrying the deadly Marburg virus, a highly contagious and dangerous illness currently spreading in East Africa. On Wednesday afternoon, emergency services cordoned off Platform 4 at Hamburg Central Station after reports surfaced that two passengers had developed flu-like symptoms during their train journey from Frankfurt. The passengers, a 26-year-old medical student and his girlfriend, were immediately taken to the Eppendorf University Hospital, which specializes in tropical diseases, for further examination. According to the Hamburg Fire Department, the passengers were flagged when the student, who had arrived from Rwanda, began experiencing mild vomiting and suspected he might be infected. He then called the fire department because he suspected something was wrong, a fire department spokesperson told Die Welt. The couple had been treating a patient in Rwanda who was later diagnosed with Marburg, an infectious disease that has been responsible for several deaths in recent weeks. The East African nation is currently grappling with its first-ever outbreak of the Marburg virus, with the country's health ministry confirming that at least 9 people have died, and more than 27 cases have been reported so far. What is the Marburg virus? The Marburg virus is a highly lethal illness caused by a virus that belongs to the same family as Ebola. It spreads through direct contact with bodily fluids like blood, vomit, saliva, and other secretions from an infected person, as well as through contact with fruit bats, which are known to carry the virus. It is not airborne, which limits the speed of its spread, but makes direct exposure extremely dangerous. Symptoms of Marburg infection include fever, headaches, vomiting, diarrhea, and in some cases convulsions and bleeding. According to the World Health Organization, the virus has a mortality rate of up to 88%, making it one of the deadliest viral diseases known. The WHO states that Marburg kills half of the people it infects on average. The history of Marburg virus outbreaks. First identified in 1967, the virus got its name after a group of lab workers in the German cities of Marburg and Frankfurt were infected while handling monkeys from Uganda. Over the years, several outbreaks have occurred in African countries, but this current outbreak in Rwanda is the first recorded in the East African nation. The exact origins of the virus remain unclear, although it is believed to be transmitted from animals to humans through exposure to bats or through the consumption of contaminated food. There is also speculation that intermediate hosts such as monkeys or pigs might be involved in spreading the virus to humans. Immediate action taken at Hamburg Station. Upon receiving the call, police and emergency crews in full protective gear boarded the train in Hamburg to evacuate the passengers and prevent further contamination. 2 tracks were closed for several hours, disrupting services at the station before authorities reopened them once it was deemed safe. The passengers' luggage was impounded, and both individuals were rushed to a specialist clinic for further testing and observation. It remains unclear whether they have contracted the virus, but their arrival from a country currently battling an outbreak raised immediate alarm. Local authorities have been cautious, as the virus poses a significant risk to public health. Emergency responders acted swiftly, and strict safety protocols were enforced to limit potential exposure to the virus. The authorities did not immediately confirm whether the individuals tested positive for Marburg, but their case highlights the growing concern over the spread of viral hemorrhagic fevers in the region. The severity of the outbreak in Rwanda. Rwanda is facing its worst outbreak of the Marburg virus, with 9 deaths and more than 24 confirmed cases as of Wednesday. The outbreak has been concentrated in several districts across the country, including the capital city of Kigali. Health workers are particularly vulnerable, as they make up a significant portion of the infected. According to Dr. Sabin Nsanzimana, Rwanda's health minister, immediate medical attention is critical for anyone experiencing symptoms such as high fever, vomiting, and diarrhea. Do not continue your daily activities if you have a high fever, a severe headache, diarrhea, or vomiting, he urged during a press conference. He also encouraged the general public to stay calm, stating, "If you are healthy, live life as normal and do not panic." Despite the growing number of cases, WHO officials have praised Rwanda's response to the outbreak. The organization has classified the risk of spread at the national level as very high, but noted that the regional and global risk remains lower. Health experts weigh in. According to an NPR report, Jennifer McQuiston, Deputy Director at the U.S. Centers for Disease Control and Prevention, CDC, said that the sudden surge in cases is alarming, as it indicates the virus may have been circulating undetected for several weeks. "We're concerned about the number of cases that got diagnosed very quickly," she said, explaining that the 21-day incubation period of the virus means that the outbreak likely began earlier than initially reported. Additionally, McQuiston noted that Rwanda's lack of previous Marburg cases might have contributed to a delay in diagnosis. "Knowing what's happening is the first important step so you can put in the right prevention measures," she said. Rwandan authorities are already monitoring 300 individuals who came into contact with confirmed patients and have implemented rigorous hand-washing protocols to help curb the virus's spread. Dr. Abrar Karan, an infectious disease expert from Stanford University, also expressed concern about the approach taken by health authorities. He emphasized the need for community health workers to visit homes of suspected patients rather than risking further exposure by having them travel to hospitals. "It would be important for community health workers to get to people's homes," Karan said, stressing the importance of protective gear in dealing with potential cases. Global response and efforts for containment. The outbreak in Rwanda has prompted global health agencies to take swift action, particularly due to the virus's presence in a major transportation hub. The WHO confirmed that one individual who had contact with an infected patient had already traveled to Belgium, raising fears of potential international spread. Despite the grim outlook, infectious disease experts remain cautiously optimistic, citing Rwanda's strong healthcare system as a key factor in containing the outbreak. Brian Chirambo, who's representative in Rwanda, stated, "We believe that Rwanda has the capacity and the ability to stop this outbreak very quickly. Although there are no specific vaccines or treatments available for Marburg, experimental vaccines are being tested." Dr. Karan suggested that the current outbreak could provide an opportunity for further vaccine development. "With Marburg, it's very hard to study the vaccines without cases, and so in a setting like this you may be able to deploy the vaccines and figure out vaccine effectiveness," he said. The health scare in Hamburg underscores the global concerns surrounding the Marburg virus outbreak in Rwanda. While health authorities in Germany and Rwanda work swiftly to contain the virus, the potential for international spread remains a concern. With the virus posing significant risks and no vaccines readily available, swift action and vigilant monitoring will be crucial in preventing further cases. Stay informed and help spread awareness. Like, comment, and share this video. Don't miss any updates. Subscribe and hit the notification button.